Hi, I'm Dr. TJ Miller. We're going to talk about interproximal brushes. Why would you want to use one of these? Now, when you have a history of periodontal disease, which is bone loss in between the teeth, you'll end up with bigger spaces in between the teeth that will catch more food. What you do, besides flossing does a great job of getting rid of plaque in between the teeth, but it may not be enough to get rid of the bigger particles of food that are stuck in between there. This is from a company called Tepi, and they've got two different types of brushes. And this one I refer to as the Traveler because you can put it in a pocket or a purse. You take the cap and put it over it so you can carry it around. Does a nice job of being small. At home, you would use this one. So how do these work? So you would take the cap off, put it on the end. It gives you a little bit more of a handle to work with. And again, you choose the appropriate diameter of the brush. So for much bigger spaces, you might want to use the green one. For smaller spaces, you may want to use the blue one. There are even smaller diameter bristles, but they even have larger than the green. So consequently, you always want to make sure you're using a brush diameter that's appropriate for the size in between the teeth. Otherwise, you could injure yourself. So you can put a bend on this little wire, and you would introduce it in between the teeth like this, and you go in between, 5 or 6 times fairly vigorously. You're not only just removing the particles of teeth in between the teeth, food in between the teeth, but you'd also be removing plaque that's on these teeth. Now, keep in mind, you still need to floss. These bristles will not get below the gum line like the floss will. So it's an adjunct. So if you notice how the anatomy of these teeth are different from the tongue side to the cheek side. So this doesn't always adapt around the tooth like the floss will. And again, like I said, the floss will get below the gum line, this won't. But you would use this again from this one you'd use from both the cheek side and tongue side. Again, in between the teeth, being fairly vigorous. If the space is larger, you would choose a larger brush. But again, don't hurt yourself. Work it in between the teeth like that. Get rid of as much of the bacteria and the food that's stuck between the teeth. The floss may not be enough to get those big particles out, but that's where these things come in. They're very handy, and they're very useful and effective. Have a good day.